Good afternoon, and thank you for joining us for today's daily media briefing with Mayor Ed Holder and Medical Officer of Health, Dr. Chris Mackie. As we did yesterday, we will limit the length of today's briefing to 30 minutes, so we will wrap up by 2:30. And once again, I would ask that if folks who are watching from the media, if you could limit your questions to one representative entering the questions into the question field. And also just picking up on something that we shared in the invitation to today's briefing, where you're able to, we would really appreciate it if you're able to stream, whether it's on air, whether it's through your website or through social media channels. If you're able to stream this live and share it with your audiences, that would certainly help amplify the message and get it out to a wider audience. So if you're able to do so, we would certainly appreciate it. We've also noted that Rogers Television has taken the step to make that happen already. So we thank them for that. All right, we are ready to go. We have some questions in the queue, but first we're going to have some statements from Dr. Mackie and Mayor Holder. And Mayor Holder, we'll start with you.
Well, Dan, thanks very much. It's important that Dr. Mackie and I are here again today to update you on things that have happened and continue to happen as we deal with COVID-19. And first, if I might say, there are many businesses in London and Middlesex County that are declared essential by the province and continue to work daily on behalf of all of us. I'd like to salute those in the manufacturing sector who remain open and the commitment their employees are displaying. In particular, I'd like to acknowledge those in the agri-food business who ensure that when Londoners and residents of Middlesex County go to the shelves of their grocery stores, those continue to be filled. London and area is a major commercial hub as a food processing community. And when I see companies like Dr. Edgar, Nestle's, Cargill, and dozens of others in the agri-food business, I want to thank them and acknowledge that what they are doing and what their workers are doing to provide the products to all of us. I can only say how grateful I am to those employees who serve. The second point I wanted to make relates to a decision that London City Council made last night with the decision to approve a number of essential construction projects related to specific city programs involving work on our roadways, water mains, things that are truly important, things like ensuring that we better provide on-site sanitation, that we, in terms of our roadworks and our and the infrastructure that goes underneath of it. And it matters the work that they're doing, and we're grateful through all of this as well. We're practicing things that are very important to all of us around the area of self-distancing to ensure these projects are safe. These are 2020 committed projects. And from that standpoint, I am absolutely pleased that our staffs and the workers associated with this are taking such a positive attitude to having this done. I would add to that the workers that are doing this are companies from around this area and the region, and it will help as we work towards our recovery as we work through into this point. So thanks very much. Perhaps we can turn it over to Dr. Mackie for his comments as well.
Thank you very much, Mr. Mayor. We are at a pivotal moment. The numbers of cases in the London and Middlesex area are remaining fairly stable at the moment, but that will not continue. We had 12 new cases yesterday, one new death, unfortunately bringing the total of deaths to 7. The concerning figures come from the provincial outbreak. There were 550 new cases diagnosed yesterday, and that gave a percentage positivity of 17%. That means of all the tests done, 17% of them were positive. That's much higher than any time in the past. The 550 cases of coronavirus that we saw announced in the past 24 hours came at a time when our testing rates are way down. So even a week or two ago, when we were testing 3 or 4 times as many tests for coronavirus, we did not see nearly as many cases. This is a worrying development from the perspective of the provincial outbreak. And as we know, London is intimately linked with the province. as is the County of Middlesex. And so what happens in Ontario will happen here as well. The issues that we need to go back to today are mirroring those that we spoke about yesterday. First of all, on getting people tested. We continue to see low numbers of people seeking testing in our community. We have capacity, and we have online screening tools that I will share at the end of the briefing today. This online screening tool connects you with your family doctor and also gives you a chance to assess your symptoms, figure out whether you should be going in to an assessment center to get swabbed or going straight to the hospital or staying home. That's a great tool, and using it puts nobody at risk. So please do use that online assessment tool and the assessment centers as appropriate. Second issue is the issue of long-term care homes. We mentioned that as an important place where you have a high-risk population, very concentrated, and really important to be able to take precautions in long-term care homes. We saw 4 new cases on top of the 9 that we had yesterday. So our total cases in long-term care homes are 13. Fortunately, we have not yet had a death in a long-term care home. However, that's likely just a matter of time. It's for this reason that the Middlesex-London Health Unit is now asking all long-term care homes, if you have mask supplies, please use them with your staff. Putting masks on staff is incredibly important to protect the residents of the long-term care homes. Residents of long-term care homes at high risk because of their age and their chronic illness, these are essentially our highest risk folks for developing coronavirus and a bad outcome from coronavirus. Masking staff will help protect staff, which is great, but it is most effective and most valuable for protecting our most vulnerable citizens, that is the residents, the patients of the long-term care homes. I'll pause there and look forward to your questions.
Thank you very much, Dr. Mackie, and we will get to the questions. And a reminder, once again, for the media who are participating today, if we could have one representative ask the questions for your outlet. The first question, Mr. Mayor, is for you. It's from Steve Young at CTV London. And the question is this: Dr. Utker is putting out a call for 19 new hires. And I know you mentioned Dr. Utker in your remarks before, Mayor. They're putting out a call for 19 new hires in all types of positions to be able to continue production through the pandemic. Given that London has already faced some difficulty in filling food production positions, are you concerned at all that the labor market won't be able to meet the demands? Do you have any concerns about food production supplies getting to food processing facilities like Dr. Utker, given the current situation?
Well, Steve, I appreciate the question. I emphasized in my earlier comments how critically important commercial food production is to London and to our region. And I would say to you that that the first thing I would tell you is that we have a tremendous number of individuals who are available for work. We've seen that through the numbers associated with layoffs, but also in terms of just the general workforce. Dr. Utker is a great employer in this community. You'll know that they supply the frozen pizzas for all of Canada and beyond through North America. So what they do on a daily basis is critically important for the food supply. So we would encourage people to who are looking for a position to contact Dr. Utker directly. The other opportunity they have is to go to londonjobsnow.ca, where we have some 3,200 jobs waiting to be filled, but we have significantly more than that in terms of individuals who are able to work. And that's been an issue that London has always had, where we've had effectively an oversupply of workers that we just have to marry up those looking for work and those employers who require people to fill those positions. I've no doubt that Dr. Utker will be able to fill those positions. I think highlighting it through this and through London Jobs Now and through their own communications that they will be able to fill the 19. The bigger question that you've asked, though, really relates to the impact on food production. It represents tens of thousands of employees throughout London and Middlesex County. So it is a significant concern if we're not able to fill those positions. But they're good paying jobs. And one thing we appreciate about Dr. Edgar, as the employer that they are, is that they will practice the appropriate health requirements to ensure that it's a safe environment for their employees to work. So with respect to that, what I would say is we need Londoners to look to these employers in the agri-food production. This is one of the first few where I've heard it specifically in the agri-food industry where they're looking for individuals. But we're not surprised. We're not surprised because of the demands that the consumers are requiring. Hence, when I talked about their role in filling the shelves and the frozen food counters in grocery stores, it's important that they continue that production on. So I'm confident that Dr. Ecker will fill it, and I would encourage Londoners looking for a position, and there are many. I certainly get a number of calls on a regular basis from people looking to work that they would be a great employer to consider. And when those jobs get filled, to keep referencing back to londonjobsnow.ca, and there will be other opportunities as well.
Thank you very much, Mr. Mayor. Dr. Mackie, a question for you now. Once again from Steve Young at CTV, and this actually is a two-part question. I think it might be three parts. So, Dr. Mackie, the first is related to the confirmation today from the London Transit Commission about a driver testing positive for COVID-19. And the question is this: do you think we need to consider suspending public transit as a means to control spread? We're currently relying also on receiving independent reports from various private and public institutions, from big box stores to the Transit Commission, identifying confirmed cases. Shouldn't confirmations where broader public contact is possible or likely be funneled through the health unit to be posted online so people can check to see if somewhere they have frequented may have had a confirmed case? So that's the first one, and I'll come back to you right after, Dr. Mackie.
Sure thing. So on the question of closing the bus service, you haven't got a lot of people on those buses right now that are taking leisure trips. The people using the bus service right now are the ones that absolutely need it, whether it's for work or for caregiving to a loved one or other essential business that they may have. And so if you close the bus, they're just going to have to travel another way. You're just spreading that risk out in a different way. I don't see that as particularly helpful. You're also seeing lots of people taking careful social distancing measures on the transit, and transit has done a great job of ensuring their routes are properly serviced during this time in spite of low volumes. So I wouldn't see shutting them down as a helpful thing overall. The question of when does the health unit make public information about a case or an outbreak that might be putting the public at risk. We do that whenever there is a situation where there is a measurable, significant risk to the public that an individual case or an outbreak may be affecting the public, and in particular at times where we cannot otherwise notify all of the people involved. A classic example would be if you have a restaurant outbreak with a high volume of clients at the restaurant. There's no way usually to notify all of them that, say, a food handler might have had an illness that was a communicable disease. But if you had a wedding where the bride and the groom have the guest list and are able to contact each of those people individually or provide the contact information to the health unit, then we would contact them directly rather than through public messaging. In this situation, we worked closely with LTC to examine what risk their staff and their clients may have been placed at. We did not direct that they should absolutely make this information public because there was no risk to the public. The way the driver sits and the level of interaction that the drivers had with a vast majority of bus riders don't put the riders at risk. the LTC made a decision on their assessment of importance of transparency for their organization, which of course we supported, and we helped them to put messaging together around that case.
I'd like to add to that, Dan, if I can, and that is that the question was in terms of what type of communication is necessary. I think all types of communication are critical to get messaging out. One thing the city did was we put out a public service announcement today in terms of the situation with this specific situation. As it relates to the buses, I concur fully with what Dr. Mackie has said, and buses are an essential form of transportation to be able to get people to and from work. We have already said do not take leisure bus rides. If you need to be somewhere, you take them. And when you get to and from work, and if busing is your way of travel, we are still suggesting to people to do that and to respect the rules that the Transit Commission has put in, such as the rear bus entry, the self-distancing on the buses as well, to make it as safe as possible for all.
Thank you very much, Mr. Mayor, and thank you, Dr. Mackie. Dr. Mackie, we have the last part of the question to you, and it relates to a tweet that you made earlier today, indicating that people who have concerns about symptoms should do a self-assessment, and if those concerns persist, they should present to an assessment center for testing. The question is, do we now have the capacity to do swab testing at assessment centers, and how soon before we have broad public swab testing? How important would that be?
Yes, assessment centers have had the capacity to do swab testing for some time now. It was always a careful balance in terms of supplies available, but we now have ample supplies there. That's why we're really making the plea that when people have symptoms, particularly when the COVID-19 checkup.ca tool asks them to attend an assessment center, that they don't hesitate to do so. And those who need swabs, need testing, will get tested. That website for those self-assessment online is covid19checkup.ca, and it's a fantastic website. It's the self-assessment tool will link you right in with your family doctor if you choose to allow it, and will give you the best advice about where you should take your symptoms. It's not for the worried well. If you don't have, a fever, a significant cough, shortness of breath, that sort of thing, then you don't need to use this tool or attend an assessment center. But if you do, you absolutely should, and encourage your family and friends who have illness. covid19checkup.ca.
Thank you very much, Dr. Mackie. Next question. This one is for you, Mr. Mayor. It's from Dan Brown at the London Free Press. And Dan's question is this: what was it like to be the only one from council attending in chambers last night? Dan would like to know how spooky that was.
Well, I think most folks would know that I'd returned from a trip to a family reunion in Florida, and was compelled to and made the decision to self-isolate. And in a sense, this is a bit like self-isolation too, because you're being respectful of all of council. I sent a note out on Friday to advise all of council that there would only be one council member in attendance, and we had the clerk and three clerks actually in the meeting to coordinate the online work, and we had one tech person. So within the room of the council chamber, we had 5 individuals. And that's the direction that we have certainly received and encouraged people. You'll know that Dr. Mackie has said time and again, groups of 5, and that doesn't mean shoulder to shoulder. We're well dispersed throughout the chamber. A little different in terms of running the meeting, but because of the technology that we have, we were able to do it, I think, well. We had 14 councillors and all staff online to be able to ask questions, respond, vote, and deal with the issues of the city. I will tell you, in the upcoming committee meetings, which are typically, well, they're made up of 6 of us on the committees. I've asked that only the committee chair be in attendance, and that the rest of us, including me, will call in remotely, and we're asking staff to do the same again as we did last night. So a little different, but I thought it worked well. Certainly no public gallery was there for comments or other thoughts. But beyond that, I thought it worked well, and I was really pleased the way that council members and our staff responded to that. I think it was the right response for the time.
Thank you very much,
and
Mr.
if
Mayor.
I could just
Sure.
add what council is doing in terms of offering leadership on strong physical distancing measures is incredibly important. I applaud the mayor, I applaud council for taking that step. They've really changed the way they do business in order to protect each other and to protect our community. That is laudable. We're doing our best to do that at the health unit as well. Dan, as you know, you're one of a very small handful of staff in the office today. Of our 300 staff, we're down to something in the range of 15 to 20 that are in the office at any given time in a space that is designed to accommodate 300. So we're able to do some strong physical distancing within the Middlesex-London Health Unit as well.
Yes, thank you for mentioning that, Dr. Mackie. Dr. Mackie, we have a question for you from Dan Brown at the Free Press. It's a three-part question. So I'll give you all three, and we'll see how that goes. On the health unit website, it now lists cases in long-term care homes and retirement homes. Why break the cases out like that? So that's the first part. Also, how many of the deaths that we have seen were in those homes? And finally, what details can you give us about the outbreak at Glendale Crossing? And I believe that that's one that is a respiratory outbreak that is still not determined.
Yes, so on I love these three-part questions. It's always great to keep the eye on the bouncing ball. On the first question about why break the long-term care homes out from retirement homes, there's an argument to be made that there's a lot of overlap in terms of age demographic and levels of illness. Long-term care homes are a specific legal designation, and in order to live in that home, you need to have those chronic illnesses that put you at much higher risk for coronavirus. And so we feel it is a valid and important distinction. Fortunately, of the 7 deaths that we've had in the Middlesex and London region, none have come from long-term care or residential homes at this time. Now, let me see if I got the third part. Right, Glendale Crossing, you mentioned a bit about that, Dan. We generally don't comment in detail about that sort of outbreak for the same reasons that we would leave to long-term, to LTC, to the bus system, the decision to make public information about their case. That's really up to the institution that is hosting the cases to make an informed decision about whether they notify public or not. Where there is a risk to the public, absolutely, we do work with the institution or the facility to make sure that the public knows that risk and that there is appropriate signage or whatever else is necessary for people to make informed decisions to protect themselves.
Thank you very much, Dr. Mackie. Next question, Dr. Mackie, is for you again. This is from Sawyer Bogdan at Global News Radio, AM 980 CFPL. Dr. Mackie, do we know why we are seeing so many cases in long-term care homes? You also mentioned the need to wear masks. Is that a factor? Do they have access to enough protective gear?
We're 3 for 3 on the three-part question. So, do we know why we're seeing so many cases in long-term care homes? The primary reason is that we are testing in long-term care homes very aggressively to make sure that we find those cases, isolate them, and try and stop them from spreading to other long-term care home residents. These are our most at-risk patients, residents in the community, and so it's incredibly important that we make sure we are on top of what is happening in those long-term care homes so that we can do our best to protect folks there. Wearing a mask for so let's talk about how the coronavirus would enter into a long-term care home. Essentially, all visits to long-term care homes have been restricted, and so We know that long-term care home staff are doing their absolute best to protect their clients, but it is generally through staff that the illness would be brought into the home. And so the recommendation today to put masks on the staff in long-term care homes would really help prevent spread to residents of the long-term care homes that are at such great risk. That's important because even when a home and staff are doing their absolute best to make sure that nobody who is sick comes to work, we have seen some asymptomatic and pre-symptomatic spread. So somebody might come in feeling quite well and still have a bit of virus, enough to infect someone who is otherwise already vulnerable. And sorry, did that get published? I'm just looking for the third part of the question. Yes, here it is. Do they have access to enough protective gear? So there are great recommendations coming out now on how to use personal protective equipment like masks in an efficient way. In the past, the recommendation has been to change masks each time you see a new patient. So that if you're out with one patient with coronavirus, you wouldn't spread the illness to the next patient who doesn't have coronavirus. That recommendation has really changed in the recognition that the risk of spreading from the use of a mask from one patient to another is extremely low. It's almost non-existent. And we're also looking, the primary use of the mask, again, is to stop the droplets that are being coughed or sneezed, or in some small amount produced with talking, from coming out of the staff and infecting the resident of the long-term care home. And so we now recommend using 1 to 2 masks per shift. That really reduces the consumption of personal protective equipment and the burn rate of masks, as we call it. The supplies situation seems to be improving moment by moment. The HMMS organization that supplies all of the personal protective equipment for all of our region, HMMS assured me in multiple ways last night that they would be able to supply personal protective equipment in this sort of situation if requested, and that was confirmed by the Ontario Health West regional table today. Very grateful for that. It will go a long distance toward protecting the most vulnerable in our community.
Thank you very much, Dr. Mackie. We do have 2 more questions, and I'm going to announce that we won't be taking any more at this point so that we try to respect the time as much as we can. Dr. Mackie, question for you from Sophia Rodriguez at CBC London. In addition to encouraging staff to use masks and cohorting of staff, what other measures are being taken to prevent the spread of the virus at seniors' facilities?
Yeah, so as always, there are strong recommendations around hand hygiene. That makes a huge difference as staff come in between patients and frequently during their shifts. Isolating people who are newly admitted to those long-term care homes is a crucial aspect as well. So that the same way that someone who returns from, say, a vacation in Florida to Canada will be quarantined in their home for 14 days, any resident who's newly admitted to a long-term care home is also quarantined in their room for 14 days with all of the isolation procedures that staff would need to make sure that even if they have something before it's symptomatic, it isn't able to spread to others.
Thank you very much. And Mayor Holder, the last question is to you. This is coming from Rogers via their Facebook live stream that they're doing right now. The question is from Dave Christine, who is watching on Facebook. Why are essential office workers still working at City Hall when the rest of operations are being shut down? A comment that Dave is making is that remote networking is essential in circumstances like these.
When we have any employees that come into City Hall, it's to deal with things that are specific, available to a file they may have on hand that may not be otherwise accessible. We've absolutely encouraged all employees who can work from home to do that. Our city administration's been very clear and I think pretty specific in that regard. But you'll find that there will be some large documents and information that needs to be accessed that may not be able to be accessed. It is not for the purpose of having meetings. We can do that easily by phone and through various technologies to be able to speak with people that way. It is only on the basis that if people need to retrieve certain information, that they do that. And for those who do work in the office, we absolutely have the rules that are crystal clear about self-distancing. We're doing the same practice that we're encouraging all of Londoners to do, and that is to maintain that safe distancing as well. So if they're here for a specific reason. If they can be working from home, they're working from home.
Great. Thank you very much, Mr. Mayor. And thank you, Dr. Mackie, for your time again this afternoon. And a reminder that we'll be back tomorrow afternoon at 2 o'clock. I won't be in the office. I'll be in the home office, so it'll look a little bit different from my point of view, but we hope to see you then. And a reminder also that with Friday being Good Friday and Monday being Easter Monday, we will hold our last briefing of the week tomorrow, and then we will resume next Tuesday. Thanks again for joining us for today.
Just as we wrap up, I'm going to do a screen share so that people have that website, okay?
Oh, this is the assessment website, Dr. Mackie?
Yes.
Excellent. All right, so we'll let that happen so everybody's got it, and we'll leave that on screen. But thank you once again for joining us for today's briefing.
Thank you all.
So here it is, covid19checkup.ca. Super easy to remember, covid19checkup.ca. And you've got a easy to use online assessment there that'll give you the best possible advice. Thanks very much, Dan. Thanks, folks. Thanks, Mr. Mayor.
There you go. And Lori, if we could just show that on screen for a couple of seconds for folks with the screen share from Dr. Mackie. Just if we could do that, Lori, can we switch over to that, please?
Looks to me like we are.
Okay. All right. Thanks, everyone. Have a great rest of your day.
Thank you.